So special enrollment period. So that was the initial enrollment period I just spoke about. The special enrollment period. Now, these are for people who turned 65 and they did not sign up for Part B because they were covered as a worker or a spouse of a current worker by a large group plan, more than 20 people. So you didn't have to sign up for Medicare because you were a special enrollee. You elected to continue to work and you were covered by the group health plan that you were in. Either you were in or you were part of your spouse's plan. Perfect. No issue at all. No penalty. Okay. So, but now let's say you turn 68 and you said, you know what? I've had enough. I want to hang the spurs up. I'm done. Well, now you're a special enrollee and now you have a certain interval to sign up. So special enrollment period for Part B, right there on my chart, anytime before your group coverage ends. So if you know you're going out the door on 10/31, well, you want to contact Medicare and get your Plan B effective for 11/1. You know, do not have a gap in coverage. You know when you're leaving, you can go and do that and make it happen. So then if you don't do it that way, okay, anytime before group coverage ends, you have an 8-month period of time starting the month group coverage ends. So you can actually, if you come off payroll on group coverage on 10/31, you could actually wait 8 months from that point and sign up for Medicare. I would not recommend you do that. You know you're coming off, make sure you have the coverage there, but you can wait 8 months without being assessed a penalty. If you wait longer than 8 months, you're going to get hit with a penalty. So why would people do that? I've had issues where things that come, people just said, I didn't know that was the interval. I didn't know I had to do that. Which, it's fair, but I didn't know doesn't cut it with Medicare. You're still going to pay the penalty. So now the special enrollment period for Part D, again, it's any time before group coverage ends or within 63 days after coverage ends. Now, I don't know why they just don't make both of them 8 months or both of them 63 days, but they don't. But there's a difference between the two. Could be because the private carriers want to get their money in the coffers quicker than our federal government. Because remember, the Part B premium goes to Medicare. The Part D premium goes to a private insurance company. Okay. Best time to enroll? Well, to avoid any late enrollment, penalties, sign up during the initial or the special enrollment period. To avoid gaps in coverage, make sure you sign up before the group coverage ends. I can't stress that enough. I cannot stress that enough. I've been teaching this class, I think, for almost 12 years now. And every year I hear of a situation where someone, for whatever reason, did not sign up for Medicare in a timely fashion, and now they're assessed a penalty. I just really would encourage you to take heart here. Do not get assessed penalties on this. There's no need to. And then, lastly, the last enrollment period is called the general enrollment period. Now, here's the deal here. If you didn't sign up either with the initial enrollment or special enrollment, well, you're left to this one. And if you miss those, then you have from January 1 to March 31 of a given year. So we're sitting here in January of 2022. We're actually in the general enrollment period right now for Medicare. And if you sign up January, February, or March of this year for Medicare, your coverage is going to begin on July 1. So what happens if you have a health event, on April 15th, you're on your own, or you need to go get private coverage from somebody, so you're not on your own. But you are definitely going to have a gap here if what you signed up for was via the general enrollment period. So just a review of the enrollment periods, and there are only 3, and which one is appropriate for you really is determined by whether or not you're working when you turn 65. So the initial enrollment, you're not working and you turn 65, or you're on COBRA, or you're on retiree health benefits, or you're a small employer, or you're self-employed. If that's you, you need to be in the initial enrollment for Medicare. If you turn 65 and you elect not to sign up because you're working at J&J or any large company with 20 or more employees, you're a special enrollee. When you do decide that you want to take Medicare and retire, well, then you want to make sure that before that group coverage ends, you sign up for Part B and Part D. And You have 8 months from Part B from the date group coverage ends, but you only have 63 days for Part D, as in David, for group coverage on ending for prescription drugs. So again, I don't know why the two are disparate, but one is 8 months, one's 63 days. And then lastly is the general enrollment. So if you didn't sign up as an initial enrollee or a special enrollee, you're left with general enrollment. And again, you can sign up January, February, March of any given year, and the coverage will not begin until July 1. So you will definitely have a gap there. So don't do that one. Okay. How do you sign up? Well, very simple. Go to www.ssa.gov, sign up for benefits. There's a radio button right there. Apply for my Medicare benefits. And that is exactly how it looks. Or you can call Social Security. There's the number, 800-772-1213, to go and sign up in case you really don't want to use a computer to do it. You can do it over the phone with them. There was a third option where you could visit offices and go in and make an appointment, but that seems to be less encouraged by the folks at Social Security because of all the COVID craziness. So, but those are two very valid ways you could sign up for Medicare. Very easy. How do you sign up? Well, how do you sign up for Medicare Part D? Well, you want to decide if you want original Medicare or you want Medicare Advantage. You know, it's not both. It's one way or the other way. So it's not both. I have to stress that because I've had people getting confused. Well, you know, after I finish signing up for original Medicare, how do I go on to Medicare Advantage? And no, it's one or the other. So original Medicare, you're going to go get A, B, and D effective with a supplemental plan. So you're going to get A, B, and D effective plus a supplemental plan. And then on Medicare Advantage, remember, the carrier has pre-negotiated, you know, A, B, and D, and usually a vision and dental plan is in there as well. And, you know, it's meant to save money. So which is more appropriate for you? It really depends on your situation. I can speak anecdotally for myself. When my brother and I were working on my mom's Medicare plan, she was an Advantage user because we were better served for her health situation that way. Her general practitioner was in the plan we chose. She was, mom was very happy that was, and she was not very concerned about the hospitals that were in the plan. So, you know, she was very happy about that. So we saved mom some money on that plan. The downside of that plan is that we would have to have been out of pocket almost $6,500 in a hospital stay for the plan to pick up and pay anything. So, but anyway, that's kind of what we did for my mom. Many people use original Medicare because they don't want to have a restriction on any specialists that they'd like to use. If the specialist accepts Medicare, then they would accept you. So if they take Medicare, they're going to take your supplemental plan because that they go hand in hand. If they take Medicare, then they're going to take the supplemental plan that covers the 20% that Medicare doesn't pay. So, but you know, those are the two ways that you sign up for Medicare. Medicare and private insurance. So, you know, again, premium is nearly half the Medicare beneficiaries' out-of-pocket costs. So this starts getting into, you know, creating a budget in retirement, which I really do like to go over with people. These are averages here, average out-of-pocket expenses. So it's about, you know, and 2016, I apologize, that's the latest numbers I have. So the 5460, I would easily say, is probably approaching $5,800, $5,900 at this juncture. So just be aware of that. And then, you know, the out-of-pocket costs for Medicare. So premiums, so the Part B premium is paid to Medicare. Private insurance premiums for Part D, drug plans, plus Medigap policy or Medicare Advantage. And then the out-of-pocket costs. You have deductibles, which I'll go over. Portion of doctor bills not paid for by Medicare. And then you have services not covered by Medicare. So if I go on, here are the monthly premiums. So Part A, which is paid to Medicare. So very important. There is no premium to be paid for on Part A, as long as you have 40 quarters of work service into the Social Security system. So this is where the two systems, Social Security and Medicare, kind of cross paths. your Medicare premium for Part A is zero as long as you have 40 quarters of work. That's about 10 years of work. If you don't have that, well, then you are going to pay premium for hospital coverage. So, and it's there. So if you only have 30 to 39 quarters of Social Security credited, well, you're going to pay $274 per month for Medicare Part A. And then you see it's almost $500 if you have less than 30 quarters of credit. Part B, right now, that's $170.10 per month in 2022. That is inflation adjusted. So every year, excuse me, you can expect that number to go up. As I said, it went up from $148.50 to $170.10. And that was a big increase. That is not standard. That's unusual. That was an unusual increase. And it was due to three reasons, by the way. So I may just tell you. So number one, COVID was really very bad a year ago. It's gotten better now, and it seems to be spiking and coming down. But because of that, they didn't do the normal increase they did. They really cut back on the increase from last year. And then secondly, in general, healthcare costs are rising. But then thirdly, there's a new Alzheimer medication out called Adahome, I think it's how it's pronounced. And it's $56,000 a year for that, which I understand they just dropped the price to $28,000. But regardless, that would be covered under Part B because it's prescribed in a doctor's office. And that was a big part of why the premium for Part B went up so much, because they really were trying to create a bit of a kitty to pay for that coverage, because they weren't sure, how prevalent it would be prescribed by doctors. They really weren't sure. So a little bit about Part B. And then Part D, again, that's prescription drug. So that premium you pay per month really varies by the drug plan that you pick. Some plans, I think the least expensive plan I've seen is $13 or $12 per month. And they run on up through there. So that's the monthly premiums you pay.